Hello, everyone. I am so excited to be back on here today. I've been out of town for a couple of weeks, out of the country, and I was trying to get on and do a live while I was gone, but time zones are just kind of a tricky thing. So, and then when I was in Ireland, they actually changed to daylight savings there, which felt very much like a cheat because I'd already been through daylight savings once here. So that means I lost an hour twice. I guess I gained it when I came back, but that was kind of funny. All right, before we get questions coming on today, I wanted to talk about something that came up yesterday quite frequently. um, there was a family that came and they had a lot of gum disease. There was a mom and a few kids, a few sons, and they had gum disease and they wanted to know what causes gum disease. So this is a question I know that a lot of you have frequently. There's two different answers to that, and it might be a combination of the two things. Number one, when plaque stays on the teeth and isn't removed quickly meaning within a couple of days, then it starts to collect minerals and it calcifies. It gets harder. And that hardened plaque is called tartar. So when you go to the dentist and they scrape stuff off, that's what they're scraping off is calcified plaque, basically. Now, if that calcified plaque stays on the tooth, it's difficult to get on once it starts to harden and calcify. So really the dentist is the one that has to get that off for you. But once that's there, it starts to attract more and more minerals and starts to get larger. And that harbors bacteria. So basically, I like to think of those big chunks of tartar on the teeth as condominiums for bugs. So they live in those condos and they start to have parties because as they welcome more and they say, hey, come on over, we can have a party over here. Nobody bugs us on this piece of tartar. And they start to have parties and they start dropping all their garbage on the gums and the gums start pulling away from the teeth. This shows up as red, swollen gums. It shows up as bone loss. Excuse me. It shows up as bone loss where the bone's pulling away. The teeth may even get a little loose. You start to get bad breath. You start to get bleeding because those inflamed gums start to bleed. They get a little tender at times, sometimes not tender at all. That's what gum disease is. Now, there's people that I find that have gum disease, but they don't have any condos. They don't have any tartar living on their teeth. So what can that be from? Well, gums have a lot of connective tissue in them. So if there are connective tissue issues, meaning you are not getting nutrients needed to help support connective tissue, or you may genetically or have some sort of illness or systemic problem that affects your ability to grow connective tissue to support connective tissue. So it may actually be a systemic or body-wide problem with connective tissue, which is another one of the reasons why it's so important to get your gums checked. First of all, we want to make sure that we're getting rid of gum infection. We're cleaning it up because that gum infection, every single time you swallow, those bacteria are going down the gut. They're getting into the bloodstream because as the gums bleed, that bacteria is then getting into the bloodstream. They're going everywhere as well. There are hundreds of research articles showing the connection between overall health issues and gum disease. So gum disease is a big deal, but it's also a really important indicator because if you don't have tartar on your teeth, but yet your gums are bleeding, you're losing bone, those kinds of things, it tells us that something's going on in the body-wide with connective tissue support. So this is something we sit up and pay attention to and go, okay, what's going on? What do we need to do to support the connective tissue health? So the first thing we do with both of those instances is we make sure the teeth are clean, but then we are going to support bacterial microbial load in the mouth. So this is where my mouth rinse comes in, a very, very important piece. Because what it does is it kills bad bugs, it supports good bugs, but it also brings something called hydroxyapatite, a combination of hydroxyapatite and xylitol, which that might sound weird, but those two things will incorporate into the dental plaque and will make it so that the teeth become stronger, but that the plaque doesn't calcify, so you don't get more tartar. It also will help that colloidal silver also helps support bacterial load in the whole entire body. So it's going to help everywhere. The other thing that you can do to help with some of those connective tissue issues, if you don't have tartar, but you have some gum disease, is something called rutin. You may not have heard of this. This is kind of like your grandma's old thing that she would used to use called rutin, and it helps to support connective tissues. So check it out. If you are having gum disease, you may need some support with that. And the second one that's even more important is vitamin C. Vitamin C is absolutely crucial for cell health, but particularly for gum health. So just a little side note on gum disease, because that's what came up yesterday for me. All right. First of all, first question we're seeing here, Can titanium dental implants have any connection to breast cancer? All right, let's go backwards a little on that one, because let's talk a little bit about titanium dental implants just in general. And I have one myself right here. This tooth right here is a dental implant. I had it placed 30 years ago, a long time ago, and it's still there. Is it causing me issues? I don't know. Let's talk about what potential issues are with titanium implants. So, the first issue is there's a lot of titanium in our world in general, and we don't really realize it. There's titanium in oral care products. It's the thing that makes the toothpaste white. It's in sunscreens. It also makes white. Cosmetics. It's in a lot of different things that we're putting on our bodies. It's also in things that we eat. It's the hard candy coating on Skittles and M&Ms of all things. It's also in paints. It's in the bags that you get from Walmart. It's in all sorts of things. And that titanium, we don't often usually see an allergy to it, but we see a buildup of sensitivity to it because there's just so much. And the body's like, I just am kind of over titanium. So it becomes sensitive. When you're sensitive to something that's in the body, your body will create an immune reaction to that thing. And again, it's not an allergy, but it's just a sensitivity. The body just doesn't love it. So it creates an immune reaction to the thing. Well, when there's an immune reaction created to something that never goes away, that's the problem. Because the immune system is now distracted and taking care of this thing, and it never goes away. As long as the implant stays, it never goes away, right? If you have a sensitivity to it. So that immune system becomes overloaded, tired, distracted, and then something else comes along, like a cell forms wrong. Well, every single day we have cells that form wrong in our bodies. Every single day. This is just part of the cellular development process. Is cells recover, rejuvenate, like your skin. Did you know that all of these skin cells are new to you as of just a couple of months ago? All of your eye cells are new to you as of a couple of months ago. So every cell, there's cell turnover in the body. Well, as those cells turn over and remake themselves, sometimes they screw up, sometimes they get screw ups. And that is really what's called cancer. It's when a cell incorrectly forms and then starts to grow out of control. Well, our body has a lot of intrinsic systems that kill those incorrectly formed cells. The immune system is part of that. If your immune system is distracted taking care of a bunch of other things, it's not going to be as effective in keeping your body healthy and safe from these cells. So, can titanium implants be related to breast cancer? Well, we're going to just generalize it and just say titanium implants, if there's a sensitivity to them, can lead to immune system dysfunction. Immune system dysfunction can lead to cancer and all sorts of other diseases. So is there a correlate? There most likely is. That's one piece. The second piece is the electrical conduction. Titanium is metal, and it conducts electricity, which is going to throw off your electrical circuit in your body. So for instance, this tooth that I have, this titanium implant is on the electrical circuit for my urinary system, for my bladder. If I were having problems with that system, I would look at this tooth and say, I wonder if this is shorting things out. So those are other concerns that go along with titanium implants. There's a connection to a lot of things in the body because of electrical conduction, but also immune system stimulation if there's a sensitivity. It's a long answer. What happens when no dentist anywhere is close to me? I'm sorry about that. I've been grinding my teeth and my sleeping is bad. My hormones are whacked out. Prolactin and thyroid. I'm finding I'm having bad allergies on my side of my face and my nostrils. I do have a deviated septum. The ENT wants to scrape something so I can breathe better. I've seen your video about around the nose and how it can be inflamed. So if you're grinding your teeth and your sleeping is poor, you can't breathe through your nose very well, most likely things are obstructed. There's just not a lot of room back here. When that happens, what it does is it throws the body into survival mode, which will then throw off a lot of the other hormones because the hormones you require in survival mode are very different in maintenance and just everyday living mode. So really the thing that I would recommend is starting with a sleep study. And you can do the sleep study remotely if need be. There's a lot of sleep studies that, like sleep studies, we can send someone a sleep study and they can be read with a sleep MD. No matter where you live. So I would start with a sleep study. If you're struggling with hormones, if you're struggling with sleeping, a sleep study is the very first thing to do. And there are nice little ones where you just put a strap around you and you sleep with a couple nights in a row. You don't have to go to the sleep center that they used to do. Lots easier nowadays. Is it really necessary to get wisdom teeth out when you're a teenager? Both my teens recently got the braces off and are both being told they need them out. It just seems like standard practice nowadays. All right, so this again goes to something a little deeper. hundreds of years ago, even a couple of hundred years ago, if we look at skeletons from that era, we see that they had all 32 teeth in their mouth. So why? Just because they didn't have people that pulled them out? No, because they actually have room. So there's a lot of people nowadays that I see, teenagers that I see, that there is no way those wisdom teeth are going to come in. And that's the crucial piece is there room for the wisdom tooth to come in? If it doesn't come in, is it going to cause a problem? So I just saw a young gentleman yesterday. He has all four wisdom teeth haven't come in yet. One of them is coming in sideways, directly into the back of his back molar, and it's hurting. So he elected to just have that one removed. That's actually not something we do all the time, but he said, I just want to worry about the one that's causing the problem. The other side's coming in pretty straight, and the top ones are coming in pretty straight. Now, there are issues down the road with a top one that doesn't have a bottom one. The top one will keep moving down, but he said, that's down the road. I don't want to worry about it. So the key question about wisdom teeth is there room? Developmentally, our mouths are developing smaller nowadays. Again, everybody's getting braces. Everybody's teeth are crooked. Why? This wasn't happening hundreds of years ago. Why? Well, because our nutrition has changed. We're eating a lot of food, but the food doesn't have a lot of nutrients that our bodies use to grow bones with. The top jaw is the first bone affected by malnutrition. So if you're not getting a lot of nutrients out of your food, then your jaws form small, the teeth can't fit. Now there's more reason to get them out. So that's the key. Is there going to be a problem if the tooth doesn't come in? And is it coming in straight? That's the question. So do your teens need them out? If one of those two things is happening. If they're not going to be able to come in on their own, there's no room for them, and if they're going to cause a problem if they don't. I feel what you're talking about is going on with me, but not what to do. Yeah, sleep study is the first starting point. So if you're having sleep issues, start with the sleep study. What's your thoughts on root canals? My mom in the late 60s had a back molar that was filled years ago, but apparently was drilled too close to the nerve and now causes pain. Should she remove it? I've talked a lot about root canals, so go check out my information that I put online about root canals. The trouble is they just can't be completely cleaned. No matter who does it, no matter how well it's done, it cannot be completely cleaned. And it does lead to problems oftentimes with immune system function. We already talked about that. Also with bone loss around the area locally, but that infection spreading everywhere. So if it's the choice between a root canal or a tooth out, I recommend a tooth out. However, if the tooth is still alive and it's just sensitive, if it's still sensitive, it's still alive, I recommend using ozone and a filling to try to keep the tooth alive if possible. So if possible, keep it alive. Don't do the root canal. See if they can fill it, crown it, whatever needs to happen. If not, I usually like to remove the tooth rather than doing a root canal. A CT scan. Can an ENT do a CT scan, and how to guide them to do the right thing if I don't want to do surgery? There's something called a cone beam CT scan. That cone beam CT scan is in a dentist's office. So it's going to be an oral surgeon or a dentist that does have a cone beam CT scan. We have one in our office. That's the scan that you need first. And then you're going to have a dentist that knows what they're looking at. Read that. There are some that will do it virtually. Read that and say, is there something going on with your airway, with your breathing, with all of that? So that's the first step, is a sleep study and that cone beam CT scan found in a dentist's office. Another wisdom tooth question. My adult daughter just went to the dentist. They told her she should have her three remaining wisdom teeth removed. They are saying they are decayed. Would you agree with this? Is it possible to send your x-rays for a second opinion? We used to do a lot of x-rays and second opinions. The problem is I just can't see everything on them. So I was not diagnosing things properly. So somebody would come, we had a whole plan, and they would come and we'd go, oh gosh, that wasn't right, because something in the mouth dictated something different than what we'd actually planned. And then our schedule didn't work right. They were disappointed because they'd come a long way to get the work done. They weren't planning on maybe an additional dollar amount. So we don't do virtual anymore. Now we actually just have you come to see us at the office. But wisdom tooth related, if there is decay in wisdom teeth, so you absolutely can fill them. That's obviously always an option. If it's very deep and close to the nerve, it might not be worth doing the work it's going to take to keep that tooth. So then it may be indicated to remove it. But the key is, can it be saved? And it's just a choice. If you want to do a filling on it instead of remove it, then do a filling. Is the toothpaste okay for kids? I have a 3-year-old with a small cavity and don't want a filling. Absolutely, the toothpaste is great for kids. Every single one of our versions, it doesn't matter which one it is, the tooth powders, they all are great for kids. It's all based on your 3-year-old, how deep that cavity is. If it's already into the dentin, the second layer in the tooth, I actually recommend getting it filled because those cavities progress very quickly. It's going to get to the nerve and you're going to have a lot harder conversations and decisions to make regarding how are you going to treat a now dying tooth in your 3-year-old. So if that filling is already into the dentin layer or the cavity is already in the dentin layer, get it filled. If it's just in the enamel, try the tooth powder. What if you do the baking soda test and you don't burp at all? So the baking soda test is one that we recommend for gut health function. And if you don't know about that, we'll put a link up here, but baking soda test is awesome to show is your gut acidic enough to actually digest your food, to break the food apart. And if you don't burp at all, the answer is no. Your stomach is not acidic enough to break the food apart. So what you're going to do is you're going to start going through our gut health protocol. Again, get on the website, check that out. It's going to walk you through exactly what to do and the order that you should do it in. Good question. All right, let's grab some Instagram questions here. I was wondering your opinion on keeping root canals if they did not begin with an infection. The dentist says they appear healthy. I also have MCAS, so I'm wondering if implants may be too invasive or if there's a risk of rejection because of my heightened immune response. All right, so question here. First of all, can you keep a root canal if they did not begin with an infection? The answer is there's a greater chance that that's going to last longer, meaning there's not already infection in the bone, there's not already infection in the tooth. Maybe the tooth was broken and that's why they did the root canal. The key is that every single root canal, regardless if it was infected or not, to begin with, has dead tissue in it. That dead tissue always attracts bacteria, no matter what. But your immune system may be pretty good at keeping it at bay. It sounds to me like maybe you have a little bit of a struggle with that with MCAS, that a lot of things are really reactive to your immune system. Could this root canal be related to it? It could be. I never promise anything, but it could be. With MCAS, could you do a dental implant? Well, you're going to need to get tested. There's dental materials testing that can be done that can see, is there an allergy to the dental material that would be the implant? And for you, I would never do a titanium implant. I would only do a ceramic implant for sure. So get tested because the root canal may be causing issues as well. I started on your 3 steps to digestive health repair the first of the year. I'm finishing my 3rd month of gut health and gut rebuild. I still have some breakthrough acid reflux at night. The gut soothe tablets help immensely, but occasionally I have to take a Pepcid tablet to stop the agony. The constipation has finally stopped and things are back to normal. My question is, do I keep on these products for another month or more? Great question. So you are going to want to start on Gut Well now, and I'm going to recommend that you do Gut Well powder. It absorbs faster and better. So Gut Well for probably 2 to 3 months, and it should hopefully help with all of that breakthrough acid that you're still experiencing, or the little bit of breakthrough acid that you're still experiencing. Gut Soothe is amazing. I would agree. If any of you wonder what we're talking about with these products, these are all the gut health protocol. You can go online and find all of this information on gut health and how to get better. Can you restore recessed gums or receded gums? The answer is yes, we can restore receded gums with a gum graft. However, they won't grow back on their own. Gums don't do that. I wish they did, but we can graft and add where that has receded. The next question is, though, why did it recede in the first place? So that's always something that I will ask is, why did it recede? We try to figure that out because you can also have a gum graft recede if you didn't figure out the reason the recession was there to begin with. It can be due to the bite, the way the teeth are hitting together. It can be due to the fact that you just were born with really, really thin gums. It can be due to a cavity in the area. It can be due to grinding and squeezing because you're not getting enough air. There's a lot of possibilities as to why it's there, and you need to really investigate and figure it out. Do you have to replace a tooth? I had a tooth removed due to a faulty filling and don't want to go the root canal route, but also didn't have a tooth replaced. Is that okay? It is okay. Teeth are connected to something called a meridian, and typically you have 2 teeth on each meridian. As long as you have that meridian activated by something, you're okay. So as long as you have some other teeth in your mouth, then it's okay to leave the tooth out. What is a root canal removal? What exactly is a root canal? Great question. So inside of the tooth, in the outside of the tooth, there's enamel on the outside. That's the part we see. The next layer down is called dentin. And then the 3rd layer on the inside of the tooth is called the pulp. And the pulp has nerves and blood vessels inside of it. So if you have a deep cavity or a deep break that actually is penetrated all the way through the enamel, the dentin, and into the nerve channel of the tooth. So this could show up as an abscess. It could show up as a major toothache, those kinds of things. Sometimes it doesn't even hurt at all. It's just a deep cavity. If the nerve has died, then what they do, or if the nerve is dying, what they do when they do a root canal is they just clean that innermost area of the tooth. So there's a canal inside of the root. So it's called a root canal. And in that canal is the blood vessels, the nerves. So they clean the nerves and the blood vessels out of the tooth. So now there's no sensation. There's no filling in the tooth. It feels great, right? It used to hurt. Now it doesn't. This is great. The problem is there's a little nutrient channels that go off of that main canal. That's how the tooth gets nutrients from the main blood vessels out to the rest of the tooth to keep it fed, to keep it nourished, all of the above. Those little tiny nutrient channels can't be filled. They're too small to clean and they're too small to fill. That's the problem. So dead tissue stays out there. And I always joke that, like, let's say you had a gallbladder attack and they said, all right, the doctor said, we're going to take this gallbladder out. Well, they wouldn't take it out, clean it up, and then put it back in you. Like, we wouldn't even think that that's something we would do, but that's what we're doing with the tooth. We're cleaning it out. We're putting some plastic material inside and we're just leaving a dead thing in the mouth. Well, dead stuff always attracts bugs. So that dead tooth always attracts bacteria. Bacteria start to find the dead tissue. They start to grow. They start to make these little cities and eat away all the bone around the end of the root. That's what we identify on the x-ray, is that bone that's gone on the end of the root. It indicates bacterial spread. Well, when that happens, when we see that, we say we need to remove the root canal. So all we're doing is removing the tooth, a tooth that has had the center point of it cleaned out and filled up. That's what a root canal is. So root canal removal is just removing a tooth, taking a tooth out of your head that has reinfected. Great question. I love clearing things up because I think it's, because I just understand it in my head. So I don't know that it's maybe not that understandable to people. So thank you for these questions. How do you find out if you have gum disease? Great question. What you do is you do a full gum exam. So this is something that you do at the dentist. The hygienist typically does it when you go for cleaning. They're going to measure 6 different spots on every single tooth. So you're going to hear 2, 3, 3, 4, 3, 2. You're going to hear those numbers. If you're hearing those numbers, that's the assessment to see if you have gum disease. And based on those numbers, they're going to say, what is the status of the gums in the bone currently? Is it hard to identify cavities? I went to one dentist and they said my son had 4 cavities and another said there is only 1. Actually, the answer is yes. It's very subjective. You wouldn't think so, but it is. We're actually getting some AI technology that makes it much less subjective, but we also have a laser that makes it much less subjective. So in our office, I use a laser to detect cavities or an x-ray. But the way we detect cavities is on the chewing surface of the tooth, we poke it. Literally, we poke it with that little pokey thing. It's called an explorer. We poke it. And if it sticks, that's our diagnostic method. If it's sticky, well, there's a lot of intrinsic problems with this method, because what if the poker thingy is dull and the tip isn't very sharp anymore, and so we can't feel if it sticks? What if the cavity is super small and it just crept through a teeny little crevice and then it spread out quite wide underneath the crevice that we could poke? There's so many different things. So this is probably why they said, one said 4, one said none, because they were poking. One went, well, yeah, it's kind of sticky. So this is why I use a laser. We shine a laser on the chewing surface of the tooth. It gives us a number. It goes, like, it makes this noise. It gives us a number. Based on the number, it tells us if there's a cavity or not and how deep it is, how we're going to need to take care of it. Love it. It's called Diagnodent. Look for a dentist that has one. But like I said, AI technology is jumping into the ring as well and taking an x-ray and saying, there's a cavity, there's a cavity, there's a cavity. They're programming it to know what to look for, because that's the second thing. On a cavity between teeth, what we're looking at is the x-ray. And we're looking for these little triangles in between the teeth. Again, subjective, because what I'm looking at on an x-ray is actually what happened to the tooth about 6 months ago. So it's not even really up to date based on what's showing in the x-ray. So I'm looking at it going, yeah, I see a cavity. Some are very obvious. They're very big. Some are very small. And some we say, let's see if you can remineralize that one. It's not big enough that I think we have to fill it. So it might be that was the difference in opinion too. Someone felt that it was remineralizable and another felt, nope, we need to fill these. So it is a little subjective. What is your opinion on chewing gum after every meal to reduce acid reflux? Well, let's think a little bit about what acid reflux after every meal might mean. You need acid in the stomach. Acid breaks food apart. That's the job of the acid. It has to be there. If you're getting acid up, what that tells me is you probably actually have too little acid. And the food isn't breaking apart very well, so it's fermenting in the stomach and pushing up its own acid as these fermentation bubbles come up. You should be digesting properly. So if you are getting acid reflux after a meal, you need to do the baking soda test. You need to find out, do you have enough acid to actually digest the food properly? What is the chewing gum doing? All it's doing is going to be stimulating what's called salivary amylase. Basically, it's an enzyme in the mouth that's the starting point of digestion. You're just going to keep the saliva flowing. So you may just be kind of bathing the stomach in some more saliva, some more enzymes. Maybe that's helping, but you need to get to the root cause. You should not have acid reflux after a meal. Find out if it's a stomach acidity issue. Any dentists in the Tri-City area today that I recommend. So if anyone's looking for a dentist, the place that I always send you first is my website, livingwellwithdrmichelle.com. There's a dentist directory on there where dentists tell us about their training, and we vet them and see if they are qualified to be on the directory. If so, then you can call them and get to their offices. These are offices that I would recommend for you to visit. So go there first. If there's nobody there in your area, then the next place to go is something called the IAOMT.org or the IABDM.org. Both of them also have directories. However, they aren't as vetted. So you're not sure exactly what you're getting, but they are the next places to look. I had a mercury filling removed yesterday. Doctor told me that my gums have infection. What is a natural way to heal the infection? So the key, we talked about that at the beginning of this, but the key with that is you're going to add, first of all, colloidal silver in a rinse. So my mouth rinse has the colloidal silver in it. That's going to help to take care of the bacterial load in those gums. The second thing is you're going to add vitamin C and lots of it to see if you can't strengthen the connective tissue in those tissues as well. You may also need to go and have that area cleaned. That's usually the starting point, is have the dentist clean it really, really well, have a good clean starting place, and then you're going to support it with colloidal silver with vitamin C. Thoughts on getting a lip tie removed on a 3-year-old? Only problem is texture sensitivity when eating. Interesting. So what's a lip tie? That's the thing right up under here where your lip is connected. Could this lead to texture sensitivity when eating? I don't know. That's something I've never heard before. So the challenge of getting a lip tie clipped on a 3-year-old is they're going to have to be sedated to do that. And so you have to decide, is it worth that? Is it worth that? I would actually maybe look more into myofunctional exercises and myofunctional therapy. Check out something called Tooth Pillow. They may be able to, toothpillow.com. They may be able to give you some recommendations there. So check that out before if this were my child, before I sedated to do lip tie removed or lip tie release, I would actually make sure it's going to help. There's not something else that needs to get done. Does a change in breath smell indicate there's a cavity or an issue in the mouth? Possibly. It may indicate that. So a bad breath may indicate a cavity or gum disease, more likely gum disease, or more likely gut problems. So do the baking soda test to see if that's what's going on. It actually usually starts in the gut. Again, mouth rinse. My mouth rinse helps for a number of different reasons. It has mint, but it also has colloidal silver that are going to manage bacteria, which would be the gum disease component of the bad breath. So I'm talking about the mouth rinse a lot today, and I'd hate to self-promote, but honestly, you just need something in there that's going to kill bugs, and it does a really good job of it. All right, how to clean around a ceramic implant. What other suggestions if you find oil pulling hard? I'm going to say it again, the mouth rinse, and you can even use it in an irrigator, in a water pick. You can put a little bit of the mouth rinse, like a capful of the water of mouth rinse in the water pick, and use that around a ceramic implant. Very gentle, very nice way to clean it. Does your tooth powder help remove plaque from the tooth? Absolutely. That's what it's for. It does not remove tartar, however. Tartar requires a dentist scraping, hygienist scraping, but plaque, it's beautiful at removing plaque. Your teeth will feel squeaky clean. My daughter has teeth coming in behind teeth. Do you recommend Vivos or something else to change the spacing? 100%. If there's teeth coming in behind teeth, there's no room for them. So I recommend doing some expansion and what we call interceptive growth, or directing the growth while your daughter is growing. So Vivos, or again, toothpillow.com is a great place to go check out. I would go check them out. I don't know how old your daughter is, but it's a great place to go. What changes could you expect to see following cavitations when it comes to overall health? So first of all, what are cavitations? I don't even like that word. And in fact, the dentistry in general has changed that word to ischemic medullary disease, chronic ischemic medullary disease, which, what the heck does that mean? Basically, it means that the bone has not healed properly and is not getting blood supplied like it should. So what are some things we expect from that? Sometimes we'll see hormone changes. Sometimes we see just immune system changes in general and gut function changes. So people will just feel real tired or have thyroid problems that they just can't seem to get on top of when there are these areas in the jawbone that have not healed properly, that there's not proper blood flow there. And so what that means is it allows a buildup of dead stuff. Again, dead tissue equals dead stuff. Dead stuff equals bacteria. So it will affect a lot of systems in the body. What do we expect to see following surgery, cleaning up those areas? What do? We actually go back in, we clean out the dead stuff, we clean out the bugs, and then we fill that up with stem cells. And what we see is a huge improvement in the whole body, overall systemic health, and everything. So it's right at 11:30, and I am going to jet. I'm so sorry I have to jump off this time because I have a meeting with my publisher for my book, and I am so excited. It's on the way. I'm meeting my editor. We're figuring out who the editor today, and hopefully, please keep watching. Please keep online. Please keep asking questions. I'm going to start doing some Q&As online as well that aren't live, that are just all of your questions that you're asking, because they're all so good. Keep asking questions. Keep searching, and thank you all for being here today.